wake of several recent high-profile mistakes at federal laboratories, USA Today's investigative team has been taking a closer look at the safety and security of research facilities working with some of the world's most dangerous germs. I'm Shannon Ray Green, and here with me is investigative reporter Allison Young. Allison, how often are these kinds of mistakes being made?
You know, recent reports we've just obtained indicate that between 2008 and 2012, there were more than 1,100 incidents reported to federal regulators. And these are incidents involving various germs and viruses. They're called select agents. They're called that because they have the potential to be used as bioweapons. So these are very serious and dangerous pathogens.
Can you tell us what happened in these incidents?
I really wish I could, but in many cases we don't know the details. A lot of what goes on with this kind of research is cloaked in secrecy, and the federal government won't release details, citing various bioterrorism laws. But there are some indications in the reports we've received that give us some idea of what has happened. In many of the cases, there have been animals that were infected that bit or scratched a researcher. In some cases, there were needle sticks. In some cases, their protective equipment failed on them. In about half of the cases, the incidents were so serious that the researcher received some sort of medical evaluation or treatment.
Did anyone get sick?
The reports show about a handful of cases where researchers, or in some cases research animals, were sickened with some of these pathogens. In the case of the research workers, the reports indicate that they did recover from those diseases. In the case of the animals, they in most cases were euthanized.
So how significant are these hundreds of incidents that you found in these reports?
You know, there are a number of biosafety researchers who look at this and say it's difficult to tell because so few details are released to the public. However, when you look at what has happened at the Centers for Disease Control and Prevention in recent months, the experts say that there are some real reasons to be concerned. At the CDC, it is one of the world's most prestigious public health labs. And in the past few months, they've had instances where they were concerned that they had possibly exposed dozens of their workers to live anthrax. And they also mixed up some lab samples and cross-contaminated what should have been a mild flu strain with a very dangerous strain of bird flu.
So scientists are concerned. Should the public be concerned?
There are those who say the public should be concerned. The CDC will emphasize that these kinds of labs have many layers of safety that are involved in order to keep dangerous pathogens inside. And in many cases, those who are at most risk are the scientists working with these pathogens. But there are outside experts that we're interviewing and talking with who say that there is reason for the public to be concerned. While it is rare, there are instances where laboratory workers have become infected and have spread diseases to those outside of the labs. And that is something for all of us to be concerned about.
Thank you so much for sharing the findings from your in-depth reporting. Stay with usatoday.com for the latest in Allison Young's story.